Hello, I'm Justin Long, Managing Director of our Investment Advisory arm here at Class Research. Joining me today is Sean Howe, our Senior Insights Director and really our lead for this year's Digital Health Investment Symposium. Sean, I'm really excited because we're on the cusp of this thing taking off here soon. It is going to be held once again in Park City at the beautiful Stein Eriksen Lodge on September 13th and 14th. And registration is officially open.
Registration is open. We're so excited this year. We've got some great things planned that we'll get into here in a minute, but we're really looking forward to it this year.
Sean, as far as those who attend this event, and more importantly, who we invite, it's a powerhouse, diverse group. And maybe you can just share who they are and why we want these folks.
Absolutely. So what makes DHIS special is, whereas with some class summits we bring together providers and vendors, think software companies, with DHIS we introduce investors into it as well. And we bring together high-level providers, high-level vendors, so think executive level, as well as investors, because we feel like that is, they're the best ones to bring to the table to have these conversations that we want to have at DHIS.
It's getting the right people in the room, right? And I think absolutely, I mean, it's the Digital Health Investment Symposium, so we want investors, but we'd be a mess if we didn't bring all three of those groups together to align.
Right.
For sure. So why is it so important that we hold this event? There's some meaningful outcomes we're looking for in the industry, right? But what are we really looking to accomplish? What are the objectives, would you say?
I would say one key objective is to align all three of those parties on the most important priorities of development and investment in healthcare. Another is to build those relationships, to create connections between providers and vendors and investors at the executive level. That can be the starting point for further investment into areas that are paving the way for the future in healthcare technology.
Yeah, you hit it. I think, as you look at each of those different groups, they kind of have their own priority of reasons that they would attend, but the commonality is exactly that, is bringing these groups together to really discuss innovation, alignment, and top-of-mind issues that are happening in the industry. And if you can bring those folks in really kind of an intersection, it ultimately will help with, kind of focuses on our mission, right? Moving the market forward. So last year's event, we closed out in September. We took a pause, and not very long for that matter, but we did I guess you would call it post-mortem into the event. We spoke with last year's attendees, and then we began planning, developing, and building out our theme, content, and panels for this year's event. And we've been vigorously doing that for many months now. As we look at kind of building, and you and your colleague are really driving the content here, but it's important to note that content isn't just something that we treat lightly. We're bringing past advisors to contribute. We're speaking with experts, and ultimately it's guided and influenced by leaders, right, in the industry, from our payers and provider community. But for our audience and those who are attending, or those that are thinking about attending, why don't we give them a little bit on the platter, so to speak, on what they can expect in terms of content and theme for this year's event. Yeah,
Justin, you're right. We spent hours and hours going over possibilities for things that we could cover, and we only have so much time at DHIS. And so we've tried to boil it down to key topics that we feel are most relevant and important. And a way to kind of frame the thinking around this is, we're in year 3 of this global pandemic. And as we looked at what we could cover, we've sensed that there's this phenomenon that's often seen in biology called punctuated equilibrium, which refers to periods of slow change interspersed with rapid development. And this is caused by environmental pressures that really drive this. And if you think about this pandemic, that's exactly what we've seen, is this period of rapid development. There's been environmental, regulatory, financial pressures on healthcare in so many ways. So there's been a lot of challenges in healthcare over the last few years, but from a healthcare technology standpoint, some amazing development and innovation. And so we really want to drill into some of these areas and shed light on some of these areas that have seen the most evolution and development. Specifically, we want to look at revenue cycle management, the technology there. We want to hear from providers on a panel as well as vendors to learn about what are their priorities, what's the vision for the future, is it aligned?
You hit the nail. I think that's an important one, right? Many times we have our innovators that are building out platform and technology that is absolutely, it's best in class with a C or K for that matter. But is it ultimately aligned with the budgets and priorities of providers? So important there as we bring providers, not only with rev cycle, some of the other topics, again, I know we have many that are going to be intertwined and some are very clear, but maybe just share a few of the other ones.
Exactly. So revenue cycle management is one that we've been talking about. The payer-provider relationship is also a very interesting one. The class as a whole has been looking at this a lot more closely, having recently held a summit with payers and providers, but we want to look at technology that can facilitate trust between payers and providers, because they really need to link arms going forward and establish that trust. And so we feel like that's an important area of focus. Alternate approaches to care delivery is one that we want to look at. So if you think about hospital at home, also we've covered virtual care in the past at DHIS, but we want to take a look at acute virtual care. There's a lot happening there. Again, as a result of this pandemic, so many of these areas have increased energy. Another that we want to cover is value-based care. It's not something new, but we're not seeing as quick or as fast of adoption as we'd like to see there. There's a lot of technology, and we feel like this is an important point to drill into and have some of those difficult conversations and explore what are the further needs of technology in this area. We know it's important, but how can we further drive that and improve that transition to value-based care? So those are just a few of the others. There's more, and we're continuing to refine them, but at a high level, that's what we're looking at for DHIS this year.
Well, really, really important topics, top of mind. One, we definitely don't want to neglect mentioning is the staffing and capacity management that our provider friends are really, really struggling with right now, right? And that is absolutely put into our content. Maybe talk about that a little bit.
Yeah, absolutely. So it's no surprise that clinician burnout and a lot of those staffing struggles are top of mind for providers. As we were considering content areas we could focus on, that one rose to the top very quickly. We know that is a hot topic in the industry. We've been working with our research director to really understand those issues in conjunction with providers and to understand the vendors that are offering really innovative solutions around that, around staffing, capacity management, those operations. How can we help providers do more with less, because they don't have much to work with right now. And so we want to focus on that as an area of exciting technology.
And things aren't going to change anytime soon, maybe for the foreseeable future, right? So it is absolutely a poignant topic. So looking forward to all of these as we jump into this. All right, for those of you who have registered, we're really looking forward to having your attendance here in a few months. Those that may be interested in attending or would like to register, there's a couple of ways of doing so. One, you can go to classresearch.com/events, or you can also email us at events@classresearch.com. We're excited. Ultimately, this will be, we're almost at the 90-day countdown, and again, it'll be held September 13th and 14th at Stein Eriksen Lodge in beautiful Park City, Utah. Again, look forward to seeing you all there.